Government and private healthcare workers or providers need to plan now for the mental well-being support of doctors. That's in order to avoid many leaving the profession or suffering in silence because of the COVID-19 pandemic. A survey conducted by the Medical Protection Society has found the mental health of doctors is deteriorating during this time. Medical Protection represents 32,000 healthcare professionals in South Africa. So for more on this, we're joined now by Dr. Volker Hedzroth, who's a legal consultant at Medical Protection. Doctor, thanks a lot for joining us this evening. Please take us through some of your findings.
Thank you, Faith, and lovely to join you. You're quite correct in that the Medical Protection Society recently conducted a survey amongst South African healthcare practitioners, and that was in about May this year. And we asked a number of questions related to healthcare practitioners and their psychological well-being and their mental health. And the result that is particularly concerning is that about a third of our respondents reported that they felt their mental health and specifically their psychological well-being had deteriorated over the previous 2 weeks. Now, that survey was conducted across South Africa's geographical regions, and it was conducted across the variety of specialities in medicine. So it's quite a broad sample with some significant results.
Doctor, a lot of times it's been said that doctors in general are running on adrenaline, right? But the big question is, what happens after a long shift when that adrenaline wears out?
Absolutely. And you're quite right. Doctors like to help, and doctors do care. And what we've found is that our respondents and our members in South Africa have reported that they are struggling with resilience. They are struggling to bounce back. Now, Faith, resilience is a concept whereby you recover maybe overnight after a hard day's work. And then you come back tomorrow with a smile on your face and a spring in your step. Now, that is resilience. And if there is a decrease in resilience amongst our healthcare professions, then that is a problem for the care that they provide to our patients. Other concerns that they have raised, also associated with a decrease in resilience, is burnout. They feel burnt out, they feel tired, they feel mentally and physically exhausted, and on occasion they might even feel quite disillusioned and detached from the care they are providing, which is not a good sign. And of course then it can deteriorate even further into other serious mental health problems like negativity, depression, anxiety, and so forth.
Yeah. Are we finding that many doctors now, as a result of the COVID-19 pandemic, are suffering from post-traumatic stress disorder?
Well, yes, or that is certainly a possibility. We should remember that a high-intensity trauma unit or intensive care unit or caring for very, very ill patients can be quite traumatic for the healthcare profession as well, not just for the patient and their family, but also for the carers. And post-traumatic stress disorder is associated with such traumas. And if it is not picked up early and managed and treated appropriately, then it can have some serious consequences and complications that can be life-altering.
And then what is being done to protect our frontline workers? Because you and I both know that the COVID-19 pandemic is a reality, unfortunately, that we all have to live with for some time to come.
Absolutely. And that is why it's important that we create this opportunity to talk about it. And I'm aware that there are other conversations in South Africa currently going on about the same interests and worries. So I think it's really important that we all talk about it. We have to create an awareness about this problem. And then we need to share our stories, and healthcare professionals need to also share their concerns. And ultimately, of course, we should all be caring, because it is now maybe also during this pandemic, which is a difficult time for everybody, patients and professionals alike, time to care for the carers.
Doctor, do we take it for granted as we close that indeed healthcare professionals or doctors and alike are actually human at the end of the day, with feelings and fears and insecurities and vulnerabilities just like anybody?
Absolutely, Faith, that's quite correct. We should never forget that the healthcare professionals and practitioners across South Africa are humans, and they also have families and concerns of their own. So whilst the usual healthcare practitioner is somebody who cares, who is committed, who is conscientious, and wants to do the right thing in a very difficult clinical scenario, and there are going to be a number of difficult clinical scenarios coming South Africa and the world's way, as it has with the pandemic, they want to do the right thing and they want to care for their patients. But of course, and understandably, they have their own concerns. Some of them might be vulnerable themselves, might have medical conditions that might make them vulnerable to the COVID virus itself. They might have family members at home that they need to care for or that are also vulnerable. So absolutely, healthcare practitioners are humans and also have fears and worries and anxieties.
Yeah, Dr. Volker Hitzeroth, we'll leave it there for this evening, a medical legal consultant at Medical Protection.